Hello, I'm Hannah Donnert with the Collaborative on Health and the Environment. Change is bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to today's CHE EDC Strategies Partnership webinar, which is the third in our series PFAS Science and Policy. The webinar today is titled Action on PFAS as part of the EU Chemical Strategy for Sustainability, an opportunity for disease prevention. Our moderator is Janon Jensen, Executive Director of Health and Environment Alliance, or HEAL. We will leave time following the presentation for a brief Q&A session. You may type in questions to the Q&A feature available on the menu bar at the top of your window at any point during the presentation. After the presentation, our moderator will read out questions for our speaker to respond to. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on the webinar right now is muted with the exception of our moderator and our speakers. This webinar is scheduled to last for 30 minutes and is being recorded for our call and webinar archive. With that, I'll turn things over to you, Janon.
Thank you very much, Hannah, for the excellent introduction, and welcome to participants who've joined us. I think it's really timely to turn our eyes tonight towards the European Union and learn more about how action on PFAS sits in its new chemical strategy for sustainability. And this strategy sets out what is viewed as the most ambitious and long-term vision for chemicals management, and if implemented, could bring substantial health and environmental benefits. So it's my pleasure to introduce our invited speaker today, Xenia Trier, who is a chemicals, environment, and health expert at the European Environment Agency. She's been working on PFAS since 2006 and received her PhD on PFAS in food packaging from the University of Copenhagen in Denmark and DUT. Her work at the EEA has focused on the risk governance of chemicals such as PFAS, including how to manage groups of chemicals, essential use, and many other issues. So thank you, Xenia, for being with us with the EDC Strategies Partnership webinar today. And I give the floor to you to begin your presentation.
Thank you very much, Janon. Can you hear me?
Yes, sound quality is excellent.
Thank you. And thank you very much for this introduction, and thank you for also inviting me. It's really my pleasure to talk about the EU chemical strategy and also the focus on PFAS to you today, and to give you a little bit of background on why it's needed and also what is the thinking behind it, which might be a different approach to how we do things in the future, we hope at least. So first of all, I want to talk about, like, why do we need a chemical strategy? What is the importance to the EU and to its citizens? And as you can see, in the EU, chemicals play a big role for our economy, but also globally. I mean, we are the second largest producer of chemicals globally. We have an industry that employs 1.2 million people, but 59% of the chemicals supplied to other sectors that also support our economy. But at the same time, we have people in Europe are concerned about chemicals. 84% of the Europeans are concerned for their own health, but 90% are concerned for the impacts that chemical may have on the environment. So to give you an example of how this can play out, I want to take you to Germany, where there was a case of PFAS pollution. So it started with soil improvers that were applied to field. But first of all, it was discovered by finding PFAS in drinking water, more specifically PFOA. And it was found out that it had polluted both drinking water, but also the soil and the food and apples that were grown in the area. This, of course, raised the question, is it in the blood of people? And what could the diseases be? How is it affecting health? And secondly, people started asking themselves, what is the source? And as I mentioned, they found out that it was a soil improver where you had added some leftovers from mill sludge, which is from a paper factory, and you think paper is very natural, so you bring in that as the soil improver to get carbon, but it contained then some of these PFAS chemicals that were used on the packaging and on paper. Then it turned out that it was so contaminated that there was a need actually to put filters under drinking water. But even before then, the people in the community had to drink water, bottled water, for a long time, because the levels were so high in the children's blood that it was of concern. And the question was then how to clean it up. I mean, and who should pay for it? And that, of course, raised other questions like who is to blame, what are the health costs, both now and in long term? What is lost income for the people who had now production of food and apples, etc., that couldn't sell it? What were the house prices? What are the ecosystem impact? And all the uncertainty that it raised in the communities. And that, of course, called for justice. I mean, who was really to blame? Was it regulation? Was it industry? And yeah, who should take action? And what I'm showing here is also that this is not the only case. We also have cases now in Italy and elsewhere in Sweden, and of course in the US, there are cases as well where we have these questions. So overall, this raises the question, how can we do it better? And is a circular economy safe, where we recycle materials? We know that we need to do this in the future, but how can we do it in a safe way? How can we create a clean circular economy and not a toxic one? And what is the role of regulation? And here really, this was where we see a call for safer chemicals. So let me take you now to a little bit of like what EEA, the European Environment Agency, has worked on for chemical pollution. And we have really worked on it since the 1990s. But I would say that attention has really focused in the last 5 to 6 years on this topic. Back in the 90s and also in 2002 and 2013, we had the late lessons from early warnings that you see here. We have then also produced a number of publications of Chemicals for a Sustainable Future, and a lot of other work where we have written reports and briefings. We have contributed to workshops, conferences, written articles, including some of the PFAS over here, safe by design materials. But I would say we have also really worked a lot with the stakeholders, inputs to processes and text at the EU level. We have had a lot of bilateral discussions with various stakeholders and provided advisory to both EU levels, NGOs, industry, and our networks. So in 2020, well, actually 2019, we published the thematic part of the State and Outlook of the Environment Report, SOER 2020, with a chapter on chemical pollution. For the first time in more than 20 years, we had such a chapter. We do these reports every 5 years, but for the first time, we had a special focus on chemical pollution. And some of the highlights we had there was we have to look at chemicals more systemically. We cannot just look at one policy silo where we look at what is the use and the emissions in this part and then forget it all the other parts. Chemicals, they are used and they are emitted along their life cycles. And as we use them, we contribute to both point source and diffuse pollution. And once the chemical is out there, they do not respect borders, they move across borders. So even if we pollute in one country, and it will move across with the fish, the air, with water, clouds. And we will therefore see that it's not just what we produce at home that contribute to pollution, it's also the products that we buy far away that bring in chemical pollution in the products, but also the emissions there will come back to us. And we saw that, we highlighted that some of the chemicals that are most of concern are the chemicals that accumulate, which means that they build up either in the environment or in our blood. And those that cause effects that also accumulate. So that would typically be something that you give on to your children. So endocrine disruption, etc., would be an example of effects that accumulate. And we have to think about not just the impacts of a single chemical, but actually of the total burden of chemicals from the various sources. We also saw then that highlighted that the risk assessment cannot keep up with all these chemicals, because we might know a lot about the hazards for some of the chemicals, but often we will not know about the exposures from all the various ways of these chemicals. And we need actually both of these to assess the risk. So really what we know of the risk is the top of the iceberg. And therefore, what we need is to go towards upstream prevention. It's the most effective tool to avoid harm to people and the planet. And to achieve that in a circular economy, we really need to reduce the complexity, and we need a transition to safe and circular by design. So in 2020, October 14th was the very happy day when we saw the chemical strategy come out based on this work and many other people's work. I mean, I just highlight some from the European Environment Agency, but of course, there's a lot of really good research and also got a lot of good work from NGOs and industry out there. And what the chemical strategy highlighted was that what we need to do is we need to turn things around. Rather than trying to prevent pollution by putting a filter on a smokestack or making it longer, so dilute it or prevent pollution from being emitted, we need to simply start the other way around and avoid producing chemicals and products that contain hazardous chemicals, or rather chemicals of concern. And then we need to minimize the use of it and minimize the use of these chemicals and better control them. And only as a last resort, we need to kind of eliminate and remediate it once the pollution is out there. And the key principles are to avoid harm to the planet and the people. At the same time, we should think about how to use and have a transition in industry towards safe and sustainable chemicals, both in the EU, but also at the international level. So let me show you some of the elements of the chemical strategy. As said, upstream prevention of risk is a key element, but also this point about the safe and sustainable by design. We need to think about how we can use chemicals safely in a circular economy. We have to think about the emissions along the life cycles. And in order to achieve some of this, we have to start speeding up risk management and risk assessment by grouping of chemicals. And think about non-essential uses. Are there areas where we don't need the hazardous chemicals of concern? Focus on the PFAS and the mixtures is one topic that we really also want to look at, because that's an example of persistent chemicals that accumulate, and the mixtures are the total burden of chemicals. And these things are those that impact mostly on environment and health. And finally, vulnerable groups is another key area, not just vulnerable children, but also workers, people who work a lot with chemicals and are exposed to it. It could also be vulnerable ecosystems. And to achieve all of this, we need strengthened legislation. But with that, let me just take a focused look at the PFAS. So you may ask, like, why do we care about PFAS? Well, first of all, it's a lot of chemicals. It's more than 5,000. Some people say 9,000 chemicals now. They're really widespread. We know that there's more than 200 use categories, and that they are emitted along the life cycles. The PFAS, the whole group, despite its diversity, they all are persistent, and they all either are or degrade to persistent degradation products. And because of this persistency, the PFAS will accumulate, which means that the risks eventually will manifest themselves when the concentrations get so high, either internally in the blood if they're bioaccumulable, or in the environment, which is typical if they are mobile. Many of these chemicals the PFAS chemicals have planetary boundary threat characteristics because they're mobile and persistent, which means that they spread fast, and at the time that we discover that they are a threat, it's too late to react, because it's often very difficult to remediate them, remove them. And lastly, I would say they are toxic. They are not the same. PFAS are not the same. There are various types. They have various toxicities. but they often have different types of toxicities, and they are often severe effects. And the very last part is that they're costly. They're costly in terms of diseases, in terms of ecosystem services to remediate drinking water, for instance, and also how they may affect house prices. So this is an example of the types of toxicity that we so far know of the PFAS. This is from the EEA PFAS web briefing from 2019. And as you see, they have very many different health effects. But the ones that are most of concern are the reduced responses to vaccines, which were behind the regulation, the EFSA, European Food Safety Authority opinion as of 2020. There are also concerns about increased cholesterol level, but in the end, it was actually reduced responses to vaccines that mainly affect the unborn child. And as you can see, the health costs have been evaluated to be somewhere between 52 to 84 billion euro per year in Europe. So this is really a lot. So in terms of like how we then manage PFAS, the trouble is that there are very many PFAS, but our analytical methods do not capture all of this. I mean, in principle, we could perhaps measure everything, but that would be extremely costly and time consuming. So typically we only measure a suite of about 20 compounds, 20 PFAS compounds. But when we then compare this with what is in various types of biota, I mean, these are some examples given here from this Nordic report in fish and terrestrial mammals, you can see the identified PFAS actually only contribute to a rather small fraction of all the organic fluorine which is in there. And organic fluorine is an example of PFAS because PFAS are really man-made chemicals. So when we see organic fluorine, we can say that that is from PFAS. So you see the black here is the unidentified PFAS, so we don't capture everything. You can then use different methods and some measure more or less, but the main endpoint is that you don't see all of it. And this means that if we are to manage all of these unknown compounds by waiting for identifying everything, we would actually be very late. So we would wait and see the pollution spreading. And therefore, managing the class of PFAS is an example of an early warning, early action on an early warning. And this may be supported by risk assessment, but the full risk assessment, as I said, would delay action. And this is part of the thinking and the background of the PFAS staff working document, which is part of the chemical strategy. And you will find the link in the slides which I provided, which will be provided. So in other places where we have the PFAS addressed as a class is under the newly recast of the EU Drinking Water Directive, where we have the 20 single PFAS, which is a sum of the single PFAS, but we actually also have the sum of all the PFAS measured in this total organic fluorine. And you can see some details down here of the legislation and the limit values. We also have in the EFSA opinion, here we have a little bit of a different approach. Here we have the risk of PFAS in food, where there's a group of PFAS of the single compounds, PFOA, PFNA, PFA, HX, and PFAS. So this is in a way similar to these 20 single PFAS. They're summed, and you have a tolerable weekly intake, and which is set at a very low level. And this is to protect the children, so the vulnerable groups of 0 to 1 that are breastfed. And the levels are set to protect that the levels in the mothers do not become so high that when they breastfeed the children that they would get too high levels of PFAS. Another way where PFAS are addressed in Europe by industry, but also outside of Europe, is in the marketplace. And in the beginning, the focus was really just on the single chemicals, PFOA, for instance, but now it's getting more general to PFC-free, which is total PFAS. And actually, as of 2021, we have the Danish industry pledged to phase out all non-essential uses of PFAS. So this is an example of actually the broader thinking behind the both the regulating the class of PFAS in Europe, but I would say in general of the chemical strategy, that when we think about risk governance, it's really beyond risk assessment. As you see here in this framework from the International Risk Governance Council, that you have actually two different areas. You have both understanding of the risk and you have something on the decision of the risk. And you see risk assessment is just one small part of it. But as you see here, there's also pre-assessment phase where you do some early warning and you do some screening. And actually the total PFAS is an example of a method that can help you screen and get some early warnings of the presence of all of these chemicals. Oops. Then you also see here, there's the concern assessment, which is where you start thinking about what are the concerns, for instance, of impacted communities, and what are the socioeconomic impacts, for instance, if people who live around the factory cannot sell their houses, are there people who are very vulnerable and less resilient in dealing both with diseases and economic impacts. And this you then bring into the risk evaluation. Is this allowing this pollution to occur? Is that really tolerable, acceptable? And is there a need for risk reduction measures? And that finally feeds into the risk management and the decision making, where you can select the option and that could, for instance, be to address PFAS as a class. So the final thing I want to mention is something that we are also starting to give some thought is how to implement the regulation, because we can have good regulations, but they're only as good as how they are implemented. So if we have some regulations that lists 100 different PFAS that you have to measure, that would be very costly. It would be likely that small and medium-sized enterprises wouldn't have the money to actually pay for this in compliance testing or the waterworks. So we are also starting thinking about how the monitoring and control can be linked with the regulation, so it makes it easy to implement. And with that, I want to just give you some last words of how we are thinking about this upstream prevention and how to apply this thinking also in the future. Because as you see here, what I've shown here is the safe and sustainable by design approach, which was the second pillar of the chemical strategy. And here we are highlighting the need to avoid chemicals of concern, which for instance could be PFAS. And I don't want to go into the details of this approach, but the point is that you think about how to avoid chemicals of concern, and only if you find that you cannot deliver a service unless you use those chemicals of concern, then you can say that it is essential for health and the functioning of society, and then you may want to address or use some of these chemicals of concern. And we have a briefing out here just as of last week. And with that, I'm coming to the conclusion that if with the chemical strategy and with the knowledge we have produced over the years, we see there is a need to address the total burden of chemicals which harm the people and the planet. We want to have a focus on how to protect those most vulnerable, for instance, children, workers, communities, and the ecosystems, and a focus on the most harmful chemicals, for instance, those that cause endocrine disruption or developmental toxic chemicals and chemicals that accumulate. Because we cannot keep up with risk assessing with the increasing number of chemicals and the diversity of them. We will always be behind, and that will mean that we will allow pollution and harm to continue in the meantime. We see that in the future that in a circular economy where we start reusing things in a way we had not foreseen originally in the linear economy, and also with climate change where we have more risks of disasters, flooding, it could be fires, it could be drought that makes chemical pollution increase in the very, so up concentrate the pollution. Here we need to take extra precaution to ensure that we really can maintain clean material cycles. And with the chemical strategy, we really hope to see a shift in the way we address pollution by bringing in additional risk governance tools that can help us to achieve upstream prevention of pollution, including avoiding the non-essential uses of chemicals of concern, managing chemical groups such as the PFAS, apply the mixture allocation factors, the MAF, across regulations, and to see a widespread transition to safe and sustainable by design. And with that, I want to say thank you for listening, and I'm looking forward to any questions you may have.
Great. Thank you so much, Xenia. Now it's time for our Q&A session. You may type in your questions through the Q&A feature available on the menu bar at the top of your window. We will get to as many comments and questions as we can. All right, Janan, I'll pass it off to you. And thank you so much, Xenia.
Yes, thank you, Xenia, as well. And the questions are starting to come in. One of the first ones is, says, very nice presentation. So glad that the EU, and particularly some parts of the EU, are going PFC or PFAS free.
Mm-hmm.
I hope you saw the very disturbing article in the press yesterday on the very high transfer of body burden to infants exclusively breastfed for more than a year. So the question is, do you have further risk evaluation planned for the time or the duration of breastfeeding? Breast is best, but how can we keep it that way?
I would, if you ask if the EU or has a plan to address that, I cannot say that we have that for now, but I know with the EFSA's risk opinion on the sum of PFAS, there we have already addressed and set very low limits, and it is foreseen that these limits will be translated into limit values for PFAS. And the question will then be, how many of the PFAS will be included? Will it just be the 4, or will there be more included? And I would say the second thing is that the 5 European countries are preparing a restriction under REACH to address the class of PFAS. And so we will see there, maybe there will be an option also to address this with this new knowledge, based on this new knowledge, that you need to lower the exposure even further.
Okay, thank you. Another question. How and who is going to drive the elimination of these compounds in both Europe and the US?
Well, that is actually a very, very good question. I'm glad you asked, because this is really who should follow up on the actions. And as well, I would say that it's kind of spread across. First of all, the EU will recast some of its legislations. For instance, there will be a revision of the Fertilizer Directive. There will be a revision of the Industrial Emissions Directive, or rather the EPRCR, etc. So there's a possibility to address, bring in more PFAS and reduce some of the limits there. But in practice, I would say it's really industry who has to do this, because they are the ones who are using the PFAS, and they are the ones who are producing the products. So this is why we think that a transition to a safe and sustainable by design of products in the future is really key. And to achieve that, it's not just enough to do a drop-in substitution. You really have to, because then you risk replacing one problematic chemical with another. So there we really need to see a kind of a different way of thinking. And here I think it's not just industry, it's also academia. What do you teach at university? Who do you teach being aware of chemical pollution? And also the role of countries, that they can support their industries with technical support centers and help this transition. So I think we really have to look at it across. And the last thing I want to say there is that that it's important to include it as well in the financial taxonomy, that what is considered safe and green is actually something which is truly safe and green. So we hope to get the safe and sustainable by design criteria going into the financial taxonomy as well.
Excellent. Thank you. Another question: why were the cancers not considering the health impact? Why were the cancers not being considered as key health impacts? I think the person's referring to the slide you had. Was it because not all PFAS are associated with cancer? Just wondering,
Mhm.
as many
So,
decisions are based on cancer incidence.
so it's true that there are many. Let's say cancer is typically one of the first things that you assess when you do risk assessment, and the previous evaluation of PFOA and PFAS were also based on liver toxicity. But it just happens that that's not the most critical endpoint. It's not the most sensitive endpoint. It's actually immunotoxicity, which is much more potent. So that is why. So if you look at, so it takes a lot lower level for an effect to manifest itself. But I should say I'm not a toxicologist, so this is my limited understanding of it.
Thank you. Uh, Two more questions around the EU. So, does the EU address PFAS air emissions and their greenhouse gas potential in the report on pollution? It's one. And what is the time scale for implementing some of these PFAS actions that you spoke about?
Mm-hmm. Okay, so another good question on the potential of PFAS to cause greenhouse gases, and you're very right. I mean, we're actually doing a report now on fluorinated polymers, where we can see that some of the raw materials, but also some of the degradation products when you burn the fluorinated polymers may release greenhouse gases. And I would say if we address it, well, first of all, we have it depends a little bit, I should say, how you define PFAS. And there's a big discussion going on, what's the definition of PFAS. But if you take PFAS as the OECD 2018 definition, where it should have at least one CF2 in it, then a lot of F gases will also be included under the PFAS definition. And that would mean that we both have F gases, which are being phased down under the Kigali Amendment, Montreal Protocol on F gases. But at the same time, they will also be included in the PFAS restriction if that definition goes through. So that will mean that it would also be air emissions that would be taken into account. And this work ongoing to understand from where these emissions could come. And under the EPRTR, there will also be some more look at where emissions of F gases could come from, for instance, from PFAS manufacturing companies. On the second question on the timeline goes as far as I know, we have some, by 2022, the PFAS restriction should be ready by the countries, but we have actions going on to 2024. And I would think that there are many overlaying actions, but they start already this year with the safe and sustainable by design criteria, and then they continue on.
Thank you very much, Xenia. I think we're running out of time, but there's just thanks a lot for an excellent presentation and for this really nice exchange in the question and answer. So I'll give it back over to Hannah.
Thank you so much, Xenia and Janan, for your excellent moderation. We're approaching the end of today's webinar. A video recording will be available on CHE's website soon, and tomorrow you'll receive an email containing a link to the video. Our next CHE webinar will take place this Thursday, February 18th, and is titled Intersectionality and Environmental Justice. This webinar will feature the research of Drs. Ami Zoda, Camila Alvarez, and Rebecca Mendel. Then on February 23rd, we will host our next CHE EDC Partnership Strategies webinar featuring Shauna Swan's new book, Countdown: How Our Modern World is Threatening Sperm Counts, Altering Male and Female Reproductive Development, and Imperiling the Future of the Human Race. Dr. Swan will be joined by experts Jerry Heindel, Terry Collins, Pete Myers, Thea Edwards, and Russ Hauser. You can find details and register on our website at healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events or more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these CHE webinars bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speaker, Xenia Trier, for taking time to present today, and to you, Janan, for your excellent moderation. Thank you so much for joining us. We're wishing everyone much health and wellness. Have a great day.